Welcome to the Alliance Lift, the podcast where we spotlight the journeys of Alliance alumni from around the world. I'm your host today, Idil Sheikh Mohammed. In this podcast, we explore the people, the past, and the possibilities of health policy and systems research, or HPSR, as some of us in the field like to call it, through the voices of those living it. From long-time collaborators to grantees and staff, each episode dives into our alumni's experiences, how the field has shaped them, how they're shaping it today, and where they're headed next. The Alliance Lift makes 3 stops along with our guests: learning from the past, living in the present, and leveling up for the future, diving into real stories behind the people powering health systems. Whether they're working in think tanks, communities, academia, or as in today's case, ministries, our alumni continue to ask important questions, spark new ideas, and push the boundaries of what health systems can do. And that brings us to today's guest, Livia Dal Zennaro. Livia is currently a senior policy officer at the Dutch Ministry of Health, Welfare and Sport, where she works on coordinating to enhance international strategic alignment and oversees the Dutch Global Health Hub. Her path to this role has been quite interdisciplinary. Livia joined the Alliance in 2020 after an internship at WHO's Eastern Mediterranean Regional Office in Cairo, right in the middle of the pandemic. But Livia didn't miss a beat. She jumped in with quiet confidence and a real talent for getting things done, helping steer finances, contributing to technical work, and played a key role in producing the 2021 Partners Report for the Alliance. It's a real pleasure to have her with us today, reflecting on how health policy and systems research has informed her work and where she's headed next. So Livia, welcome to the Alliance Lift. Do you think that introduction did a fair job of capturing your experiences so far?
Yes, thank you very much. It's great to be here, and it's also very nice to hear this introduction, and it brings me back to a lot of memories as well at the Alliance. So thank you for that.
Wonderful. Let's rewind a little. This is our segment called Learning from the Past. If you had to describe your early career in just 3 words, what would they be and why?
Thank you for this question. I think if I would describe my early career in 3 words, it would be evolving, unplanned, and collaborative. The reason why it's evolving and unplanned is because it grew in ways I wouldn't have anticipated. My entry into health policy and systems research, it was quite unplanned. It started as an opportunity at WHO and later at the Alliance, which opened my eyes to this field, which aligned deeply with my values. It's been a constant process of growth and discovery, which was shaped by the generosity of the people working in the field and particularly my colleagues at the Alliance.
I love that. You already painted such a vivid picture of the driving factors that have contributed to get to where you are today. You touched a little bit on it, saying it was unplanned, but what would you say first drew you to the world of health policy and systems research?
So to be very honest, as I was saying earlier, I entered the field somewhat by chance. I didn't plan my role to step into the Alliance, but it gave me the opportunity to learn health policy and system research. I found it deeply relevant and intellectually very engaging. HPSR, it drew me because I realized that real change often happens through policy, and that is what shapes health systems and where the most pressing challenges are, and therefore also the solutions. In hindsight, through my experience, and particularly the work at the Alliance, I see how HPSR now has given me the tools to bridge gaps between research, implementation. So I would say it wasn't a calling at the start, but it became, for me, a foundation which I still use in my work today.
That's amazing to hear. So before we fast forward to where you are today, I wanted for us to have a little bit of time to discuss more about your time at the Alliance. You joined WHO and the Alliance during a very unusual period, the early days of the pandemic in 2020. What was that like for you?
During COVID?
Mm-hmm.
Or before, sorry, yes. So I would say very, very exciting on the one hand because I was going to work at the Alliance and I was supposed to move to Geneva and work at WHO, but on the other hand, also very challenging. I had been far from home. I was working in Egypt. I was there by myself, and all of a sudden I had to move back to the Netherlands. So it was also challenging, as it was, I think, for all of us. But at the same time, it gave me also a lot of opportunities to learn and to really understand what was important. And I mean, I was at the WHO during COVID, so yes, it really shaped. Yeah, sorry.
Yeah, no worries at all. Sorry for cutting you off. And looking back, how would you say your time with the Alliance then particularly helped shape your journey, whether in terms of what you learned, how you approach collaborations, which is something you touched upon earlier, or how you see the role of research in informing health systems and health policy?
So I would really say that the Alliance was the opportunity of a lifetime. Starting my career at the Alliance, it showed me my passion for public health is where it came to life. I got the opportunity to do a master's in public health while working at the Alliance. Yeah, I sometimes wish I had discovered the field earlier in my academic journey, but the guidance that I received from the Alliance, along with the support of the broader community, gave me the confidence to continue. And in terms of research, now that I work at the ministry, I really understand the importance of it. So it's giving me an understanding of the complexities and how research and systems thinking can help in taking a step back and approach it in a different way.
Yeah, it sounds like being at the Alliance became more than just a workplace. It became sort of a learning ground for you, a place for growth and exploration, a springboard into the wider world of public health, it sounds like.
Yes. Thank you for saying it like that. I think that you are really pinpointing what I wanted to say.
Wonderful. So let's fast forward to today, living in the present. How does your broader background, including your experience in health policy and systems research, shape the way that you approach your role today as Senior Policy Officer at the Ministry?
I would say that HBSR really influenced the way I think and approach my work. I think it has helped me develop the ability to ask the right questions. And with the right questions, what I mean is questions that are essential in understanding the complexities of health systems, but also systems that we live in general. At the Ministry of Health, me and my colleagues, we navigate political and challenges. So there it's key to understand these systems. So I really find myself using the mindset to assess issues from multiple angles. So my current role is not about really applying specific tools of HBSR, but more how I frame problems, engage with stakeholders, but also ensure that when I am in a discussion about shaping policy, that it's grounded in real world feasibility and that we keep in mind who we are doing it for. So I would really say that my academic background, but definitely HBSR and my experience at the Alliance is what has influenced how I approach my work today.
Yeah, and it already sounds like you started to answer my next question, which was going to be, what would you say is the most rewarding part of what you do today?
I think that's a very interesting question. I mean, there's so many challenges you're all experience firsthand, complexities around multilateralism, global health threats that we are currently facing. So working together with stakeholders in the field, bringing them together, trying together to find effective solutions is very rewarding. But also facilitating collaboration within the ministry on international initiatives allows me, I think, to bridge a gap in this fragmented world. So it allows me to still work together to achieve a shared goal and progress.
Yeah, and you touched upon it just now as well, but is there a particular project or challenge that you're working on at the moment that you're especially excited about?
So I'm very excited about I coordinate the work on the Dutch Global Health Hub, which is an initiative that came from the Dutch Global Health Strategy. And it brings together initiatives, projects, and stakeholders in the field of global health in the Netherlands. And together we try to approach issues more in the field of health systems, climate change, so very relevant topics. And we try to approach this together. I would say that.
It sounds like you really are right in the middle of it there at the ministry, and it's wonderful to hear. So let's shift gears to the future now. This is leveling up. So Livia, if someone is listening right now and is starting out in health policy and systems research, or is perhaps considering entering the field, what advice would you give them?
My advice for entering this field would be to stay curious, embrace the complexities of the field. HPSR is constantly evolving, so I think it's important to adapt and actually be the one that drives this change. Be open to new ideas, be open to perspectives. Collaboration in this field is key. Also, I think what I've learned and what I would recommend is to be patient. It's essential because change in health systems and policy takes time, but when it does happen, it's very meaningful.
Amazing. And looking ahead personally, what are some emerging trends or ideas in health policy and systems that you're particularly interested in or excited about?
What excites me is, I think, the growing and deserved recognition that HPSR is having, and the opportunity that it has in today's world, where the values that we hold dear or we thought that we had are being deconstructed. I very much feel a sense of urgency, but also sometimes I feel pessimistic. And I think that in this context, it's exactly where HPSR can play a pivotal role. So I'm excited for that because it can keep a focus on equity, on social justice, and also on practical solutions. It can provide frameworks for building health systems that are resilient to what is coming in the future. So now as a policymaker, I do see how crucial this is. We would say this a lot at the Alliance, how policymakers are under pressure and very busy. I do see that now, but I think that HPSR also has given me the tools to step back and think about how these systems are shaped and how we can move forward to that and change things. So I think, yes, what excites me is the role that HPSR can play in this.
That's such a wonderful reflection to hear sort of how you're using HPSR in times like these where it's easy to lose hope or focus or feel distressed, that it's kind of helping you find your ground and staying focused on what matters to you and to others in the field. Stories like yours, Livia, are a great reminder of how global this field is and how interdisciplinary it is. And it's wonderful to hear how meaningful change can happen when thoughtful, dedicated people like yourself set up. So thank you so much for agreeing to join us. Before we close, do you have anything else you would like to share with our listeners?
Yes, thank you. I would like to add how actually excited I am about the Alliance Alumni Network. I think it can be a very special tool to broaden the scope of HPSR, as it brings together professionals from so many sectors and roles, reflecting the diversity of the field itself. I think that even when alumni move in different positions, such as myself, whether it's policy, academia, or other international organizations, benefiting from each other's experience and expertise is so important. And I think that this network allows for for these collaborations and helping also the reach of HPSR to ensure that HPSR continues to bridge the gap in research, policy, and practice. So thank you for this.
Wonderful. Thank you so much.
Thank you, Edith. It has been wonderful to talk to you and to think back on my experience and wonderful time at the Alliance. So thank you.
Thank you. And to our listeners, you've been listening to the Alliance Lift. I'm Idil Sheikh Mohammed. Thank you so much for taking this ride with us. If you've enjoyed this episode, please consider sharing it with others in your network, especially those in the health policy and systems research community. You can also sign up to the Alliance Alumni Network on LinkedIn to stay connected to all the latest happenings in HPSR and to hear more stories like this one. Until next time, take care and keep doing the work that lifts others too.